All right, and now I would like to introduce our speaker today, who is Dr. Cliff Gronseth. And so Dr. Gronseth is a triple board certified doctor in physical medicine and rehabilitation, or electrodiagnostic medicine and pain medicine. He is the founder and managing partner of Spine West, the largest physical medicine and rehabilitation private practice in Colorado. Experts in spine and sports medicine providing outpatient non-surgical orthopedic care. Besides that, Cliff is also a Rotarian, and he is the founder and chair of the Niyagi Project, which means Now You Are the Group's Interest, a Boulder-based nonprofit focused on saving pregnant women's lives in forgotten corners of the world by teaching ultrasound skills to remote healthcare workers. Cliff and the project have worked in Nepal and Haiti, with future projects planned for Nicaragua and East Africa. Cliff enjoys exercise, especially running and sculling, and he is one of the several Boulder Rotary Club members who have participated in the Dancing with Boulder Stars, a fundraiser for the YMCA of Boulder County. And you take it away, Dr. Gronseth.
Okay, thank you very much, Sally. Thank you for having me. What I'd like to do today is just tell you a little bit about what's occupied my life for the past few years. It's become my passion, and I thought I would share it with the Rotary Club and see if there's interest in perhaps joining me. The concept of the Niyagi Project, it's a little bit of a strange name. It's a Boulder-based, small startup nonprofit in a sense, but we have a very enthusiastic core group of people that are involved with it. So I'll just jump right in and say, what or who is Niyagi? I created the name Niyagi. It stands for Now You Are the Group's Interest. The idea is that it was a universally applied name for that mother or child in remote areas of the world that have little access to healthcare and certainly for diagnostic imaging. So this is Niyagi that you can see right here. This is Niyagi over here. You'll see on my slides series of numbers. And the reason I bring that up is because the Niyagis around the world, these mothers in remote areas of the world, they die every 2 minutes, which is a strange concept. Yeah, it is 300,000 a year. Now, what does that mean? Well, if you do the math, that's equal to every day a 747 full of Niyagis, full of pregnant mothers, die. Imagine waking up every morning and you just read in the paper, another 747 crashed and died full of mothers. So the Now You Are the Group's Interest acronym is based on the intent of trying to educate healthcare providers in remote areas of the world how to do ultrasound, try to empower them with the tools to continue learning rather than just kind of a one pulse, one and done type of education, and try to elevate the local, regional, or and in this case in Haiti, perhaps a national level, elevate their healthcare system. So these numbers will change every 2 minutes. It represents that mother that just passed away. So this is a representative of who we teach in Haiti. This is Darlene. This is a Haitian mother who was attended one of our teaching sessions in Haiti. Darlene is a physician that works in a government and private clinic in Haiti. And this is what we're trying to teach them: ultrasound. Ultrasound is used in nature for 50 million years for bats to find food. The original research for ultrasound was developed by the Navy after World War I to identify submarines and other things underwater. And interestingly, this was the original ultrasound research. This is the Hubbard tank that was developed right here in Boulder, Colorado, up on the hill. That's the roots of ultrasound for us. Today, the ultrasound machine is literally handheld. That's an ultrasound machine. The technology has miniaturized ultrasound, so it is portable. It plugs into a phone or an iPad. So this is as difficult to carry as it gets right now. So the technology has really accelerated from the Hubbard tank to something which is safe, portable, and now getting less expensive. What we teach is something called placenta previa. For mothers that have had children, you know that the placenta is the main feeder for the baby, and it's basically a bag of blood vessels. If the placenta lies low in the uterus, right over the birth canal, when that baby is about to be born, the birth canal opens, the mother dilates, and if that placenta is sitting low, this bag of blood vessels will rip open and the mother and baby will likely die, especially if they're not near a medical center. So what we do is we teach ultrasound to healthcare workers in remote areas of the world. This is a picture of me trying to teach ultrasound to skilled birth attendants, kind of quasi midwives in Nepal. And we try to educate them on the intricacies of ultrasound, but the basics. And we figured out a system which is very effective, accelerated, and empowering so that they can then take this information and continue to learn. Because the biggest problem with learning anything is, one, you only hear about 30% of what you're told, and the next day you've forgotten about 90% of what you heard. So you're within 24 hours, you're left with about 2 or 3% of the information that you heard the day before. I'm hoping that this lecture, the take home is that you'll remember every 2 minutes. If nothing else, I hope that that sticks in your brain. So this is the hands-on teaching sessions that we did in Haiti, and we've done that in Nepal as well. We also have an iPad Saving Lives program, which is repurposing old iPads that we load with software that I created for learning ultrasound. The software sits on the iPad. It does not require internet access to use, so it can be used anywhere. And that allows the students or the providers to continue to learn. So they oftentimes they get the machine and they get an iPad with it so that they can use it at the bedside to continue learning. And this elevates the quality and the education of the healthcare system, so it's scalable and sustainable. The software can also be used to educate the mother so that they can explain what is happening with their baby, or perhaps why they need to get out of the mountain village in Nepal. It might be a 2-week walk out of the mountains to get to the nearest hospital. Imagine 9 months pregnant, going over 18,000 foot passes just to get to a hospital, because if you don't, based on the ultrasound findings, that mother may die, will die, if she has placenta previa that you can identify with ultrasound. So what have we done so far? Well, as I mentioned, we're now at 4 Niyagis, by the way. We have been to Nepal. Originally, we were there in 2016. We went with a small group of teachers to kind of pilot test our program. We taught about 30 skilled birth attendants how to do basic prenatal ultrasound scanning. And they came from all parts of Nepal. Some parts, like I said, are up in the Mustang region, which are perhaps 2 weeks away from a medical center to deliver their baby. This is the small team we went to, made of expert sonographers, had a support person, and my wife Nancy over here, who kept notes and kept me organized. What was interesting in 2016 when we did it, it was a grand success. When we got back, we were told this was absolutely amazing. We had no idea you could teach ultrasound, such a complicated task, in a week, because we were only there for about 5 days teaching. The problem was when we got back, they didn't know how to use the iPads that we gave them. So we had to, on the second trip, we went back with high school and college students along with the teachers, and they taught the ultrasounds, the iPad skills to the nurses that were learning. The results in Nepal have been tremendous. They're collecting data. Our partner there, called One Heart Worldwide, which is a nonprofit based out of San Francisco, and they're telling us that anywhere from about 20 women are being referred out of the mountains every month based on the ultrasound findings of the skilled nurses that we've taught. So that's, say, 40 lives saved, the mother and the baby. And they, in fact, in Nepal, they were so enthused with the program of using ultrasound because they were a little skeptical. They have now moved from 10 ultrasound probes that we brought, and they now have 100 machines over there, and they're planning to buy more. They tried to populate the entire country. We then shifted over to Haiti. We had an opportunity to partner with an organization that is working with a USAID grant in Haiti. And as many of you may know, Haiti shares the island with the Dominican Republic. Haiti is the poorest country in the Western Hemisphere. It's oftentimes devastated with natural disasters, and the politics are abysmal, but the people have great spirit. So what we've done there is we've been there 3 times, again, using our model of training the healthcare providers, but we shifted a little bit from training new providers, or I should say, teaching providers that are new to ultrasound, to training the trainers. And that way they can then become teachers themselves, and they can teach their colleagues how to do the ultrasound using the machine, using the iPads with the information on it, and also other now e-learning that we're providing for them remotely, to empower them with the tools to diagnose basic prenatal life-threatening conditions. This is Larry Exantis, Dr. Exantis. He's a radiology physician in Haiti who is our master trainer now. I speak with him almost daily, trying to coordinate the education system for the ultrasound in Haiti. And he does both in-person training. Because of COVID, we've had to pivot a little bit, and we are not traveling down there because Haiti has about 50 working ventilators for 11 million people. So it's not a place that I would like to bring my team down and end up on a ventilator. But we've shifted over to technology, and this is the camera that I'm actually showing you right now. This is a group of Haitian doctors that we taught just last week via Zoom, and we are now able to, from my office here in Boulder, teach down to Haiti. And in theory, since we're testing it out in Haiti, this Zoom remote e-learning system, we can teach anywhere in the world the skills that we're doing. This was some photos we just got back from one of our providers. We have shifted not only to maternal health, but also to COVID. You can diagnose COVID pneumonia with ultrasound, and because there are so few CT scans, X-rays, MRIs in Haiti, and certainly not accessible to most of the Haitian population, ultrasound is a very fast, safe, and portable system that can diagnose COVID pneumonia because it has a very characteristic pattern on ultrasound. And the other thing that we're doing is we're gathering data. We're using a software called Survey Anyplace, which again works offline, does not need internet access to gather the data. And when the provider gives us the data and they connect to the internet, it automatically uploads to us so that we can measure the outcomes. This is a sample of how we teach from my office. This is my software showing here's the purple, the placenta and the uterus, etc. Much more involved than you probably want to hear, but this is how we're able to harness the power of technology to teach providers overseas. We're now up to 8 Miyagis. This is a sample for those interested of what COVID looks like on ultrasound. It has these laser beam-like streaks, which are abnormal, and it's basically fluid in the lungs that develop in a very patchy distribution. So the concept of Miyagi is that we're trying to incorporate technology into low resource remote areas of the world, which is challenging because, as you know, some of them don't even have food, and here we're trying to install high technology into remote areas. But we have been able to successfully teach them ultrasound, and they're incredibly tech savvy, many of them, at least the younger ones. And this is a high school student from Monarch that came with us to Nepal. We are incorporating their skill set of technology into this Niyagi project because it's bringing the resources of multiple people, multiple skills into the projects to really focus on saving the mothers' lives. So where are we headed? Well, as Sally mentioned, we are planning to perhaps do a project in Tanzania and Kenya, East African trip. We were planning that before COVID hit, and unfortunately we will be on hold for that. But because of our learning experience with remote teaching in Haiti, we will be able to probably start the project over there once we find the master trainer. We're also working with a partner in Nicaragua in hopes of doing a pilot study down there to try to elevate and educate the providers in one of the northern regions there. We're also looking at the Indian Health Service because that's right here in North America, and they're in dire need of some of this prenatal ultrasound scanning simply because of the remoteness of some of these communities. So we have been to Nepal, in Haiti. We're hoping to perhaps bring this type of education globally. That's my ultimate vision of this. Is to my vision statement is that every mother, no matter where she is in the world, deserves to have access to prenatal ultrasound so that she can deliver her baby potentially safely, or at least be told that she needs to deliver in a hospital before she goes into labor. And that warning can literally proactively save lives. This is a sequence of images. We can geo-track the iPads that we present down. This is Nepal. I'm zooming in with the Find My iPad technology, and we can drill right down into the local clinics. And we know who this provider is, who owns or who belongs to that iPad, and we can have the person who donated this iPad know from the clinic how many lives their old iPad is now saving just by doing this communication with the providers and also geo-tracking these iPads. So I will, I was going to play a short video here which summarizes our work in Haiti, and then I'll open for questions.
The Haitian healthcare system is a very challenging place to operate.
The medical problem in Haiti, they are a lot.
We have lots of geographical restrictions, poor infrastructure, poor internet, poor electricity.
If you go to the countryside, most of the people there are poor people, people who can't afford healthcare.
Ultrasound is probably the only diagnostic tool that we have in a lot of places outside of Port-au-Prince that can really change the way we treat patients and make decisions about patients.
Ultrasound can really enhance the diagnosis that the doctors are doing.
So with the Niyagi Caris collaboration, you know, we're really we firmly believe that we need to leave the skills, create a dynamic base of teachers in this country that can use the technology well to serve patients, but also really train other practitioners and other, you know, throughout the whole country, really to create a network of people that can use ultrasound and to, you know, so that the whole population can have the benefits of this.
The whole focus is to empower the local providers, to give them the knowledge and the tools to do the ultrasound and also to pass it forward. We're going to show you hearts, bones, kidneys, wrists, shoulders, hips, yeah, everything. Okay, so have an open mind. Today you learn things that are new. We want you to teach the rest of Haiti.
It's just getting the training right, the training model correct. It doesn't just keep relying on people to come from, you know, teaching hospitals in the US to come and do that, but to create that education and training base in the local, you know, in the local country. That's the exciting bit for me.
And we will have other physicians become teachers, and they will teach other people. And I guess in the long term, we'll have like a whole fleet, like a big army of teachers, you know, teachers teaching other people, and other people becoming teachers and teaching other people. And in this way, all the ultrasound machines that Niyagi, Caris, Projet Santé will place in the different sites, you will have a doctor on site who actually knows the basics, who actually knows how to use it, how to make the correct diagnosis, how to prevent a serious adverse event to occur.
So we hope that we can continue with this program and make the difference in life of many people, because we want it.
And, you know, we're lucky to be able to work together with the Niyagi and Caris to really get it going, because I think this has a really big future.
You're contributing to one of the greatest needs of the healthcare system of Haiti by doing this project. So I just want to say thank you. This matters the world to the people that go to your facilities, or the facilities that you're training the technicians from, and it will be immediately utilized.
We can take this teaching model that we have that we used in Nepal and Haiti, and we can bring it globally. We can go to any country that's interested in incorporating ultrasound into their medical system, and we can go in there and we can create a natural, almost like an ultrasound school system that can then be used to educate more and more people.
Miyagi! Projet Santé, Miyagi, a fait bon travail par ici. Good job, Miyagi. Good job. Good job. We are very happy. We are so happy for that.
So that is that's our work in Haiti. We brought a videographer with us on the trip, and he gathered those interviews. So one of the reasons I joined Rotaries was the concept of this latest cover for the Rotarian, which really was, you know, if you read the subheadings, you know, we solve problems, we bring people together, and we do the hard work. And, you know, I totally resonate with that philosophy. This could be a model for Niyagi and everything else, except I'd put a mother on top of that image. And with the emphasis on maternal and child health, I feel like it is apply to kind of the Rotary International goals. And so that is the summary of the project. I want to do one little show and tell before I sign off. I'm going to show you my heart right now. real time with a probe. That's my heart beating as we speak. It may be a little dark for you, but I'll make it a little brighter. That's the beauty of ultrasound. And it's totally safe, totally portable, and life-saving. So I'll open up for questions.
Thank you so much, Cliff. That was very exciting. And as you know, several of us in Rotary have had an opportunity to learn a little bit about this and are very excited to help you move this forward. I'm a little worried about that posterior leaflet of your mitral valve there, though.
Yeah, we'll talk about that later.
Yeah. Anyway, Mary Jean Ewing has our first question. Mary Jean?
Unmute.
Yes, Cliff. I am no longer in Boulder, we're in Washington, and I will be working on this new district to get them involved as well. As you know, I worked on a project in Haiti using midwives for Haiti to train, and the point of the program was to train those women in the small communities in the mountains that were actually doing the work, not midwives in the hospitals. And I think your project will lend itself wonderfully for adding to not only ultrasound training, but also the broad base of prenatal care and delivery safety to those women who are doing deliveries. It is such an incredible entry into the hinterlands of any country that you're working in. And I salute you for that. What I wanted was maybe if you had a demonstration of an actual woman whose life was saved because you identified a placenta previa or whatever. As you know, preeclampsia and eclampsia is the most common cause of death in Haiti amongst the women. It's a tremendously high incidence in that country. And that's an additional issue that doesn't necessarily relate to the ultrasound, but it's something that is important for the caregivers to recognize early.
Sure. Well, yeah, I can give you many stories. The ultrasound is really it's an extra tool. It's going to replace the stethoscope in medicine one day.
Absolutely, it's already
in
doing
this
that.
country and around the world. It's just hard to learn. In fact, Haiti will probably be more advanced with ultrasound skills than United States physicians by the time we're done. But case in point, when we were actually training the skilled birth attendants in Nepal, there was one afternoon where we ran out of patients, pregnant mothers. And so we said, well, let's just scan each other. The women, there was mostly women that were learning the ultrasound skills. And oddly enough, one of the skilled birth attendants was found to have a large mass on her ovary. And she was in the OR 2 days later after getting further workup because of what we found in that skilled birth attendant. And then there's multiple stories about women that, like I showed, had placenta previa, where they were at risk for just hemorrhaging if they stayed in the village to deliver. And there are cases where you have molar pregnancies where the fetus, there's no real fetus, but you have growth of tissue in the uterus. And those are found quite frequently. If we go back to the slides of the data from Nepal, there was about 160 cases of specific diagnoses based on the last year that were referred out for various conditions. For preeclampsia, that's a blood pressure issue. And what's interesting, to your point, Peter, is we are now teaming up with Helping Babies Breathe, the HBB program, and also some other software tools, something called iBirth, which helps educate the healthcare providers how to take care of women in the during pregnancy. And all that can sit on the iPads that we donate to the different clinics. So we can keep stacking on more and more educational material to the iPads, and we can even transfer it to the iPad remotely when they connect to the internet. So it's unlimited how much information we can share with them. And using this teleeducation technology, we can get experts like yourself, or Helping Baby Breathe representatives, or anybody to come in and teach remotely, because we're working out the technical nuances of teaching. So I appreciate your interest, and I know that you have a very strong interest. I wanted to talk to you about Haiti as well, because of all your connections there.
Thank you.
Okay, thank you, Peter, and thank you for that answer, Cliff. I wonder if we could have Bill Anderson now ask his question.
Cliff, thank you so much for the inspiring talk and the work that you're doing. I can't help but be incredibly inspired by it. But one question I had was, how many ultrasound devices has Niyagi put into the field at this point, and how much does each one of the ultrasound devices cost, independent of the iPad and the iPhone?
Yeah, it's a great question, Bill. The biggest barrier that we have found is the cost of the ultrasound machines. This is new technology. It's called the butterfly probe. This is about $2,500. The machines that you typically see in a hospital cost anywhere from $35,000 to $125,000, and that's the standard concept of what an ultrasound machine costs. And so there have not been a lot of interest in spending $35,000 for one clinic to get an ultrasound machine, but the cost of these probes is coming down dramatically. There's a lot more competition, and we have other probes that are wireless, etc. The number of probes that we started in Nepal with just 10 to see if it would work. And now, like I said, they have over 100. I think they have 120 that they've then purchased. This is the partners that we work with. And one of the Nepalese partners is co-sponsored by a Rotary club in Australia, oddly enough, and they provide some of the funding for the ultrasound machines for Nepal as well. But our partner organization has been smitten with the concept of using this life-saving device, and are now trying to arm all of their midwives with the ultrasound machines. In Haiti, they started with 40 machines. They purchased with a grant from USAID, and the machines were actually purchased originally for Zika virus, because you can diagnose some of the manifestations of Zika in babies' brains with ultrasound. And the ultrasound machine, Zika was eliminated in Haiti, and then they transferred the technology over to helping mothers identify the life-threatening conditions. And now the Haiti project has gone so well, they just bought an additional 40 of these portable machines and another 20 of the more desktop type of machines. So over 120 machines are in Haiti, and they plan to get more because this is just starting to get momentum in Haiti. Our intent for Haiti is to populate the entire country with ultrasound in all of the clinics. almost, like I said, replacing the stethoscope, because they can then refer the patients to higher level of care based on what they find on the ultrasound. And that allows a very efficient use of resources in the country, rather than having normal prenatal scans at the main city hospitals in Port-au-Prince clog up their system. The hospitals with the capacity to deal with some of these potential complications can really see the pre-selected women that will need higher level care. So it's going to be a much more efficient use of the time. It's going to prevent the patients from having to travel to the city unnecessarily and necessarily, because with the identification of life-threatening conditions, they will know that they have to go to the hospital. For example, in Nepal, they have no interest in walking 2 weeks just to get to a hospital just because they're pregnant. But if you tell them, if you don't, you will die, and so will your baby, and your children will be orphans, and it only takes one death to convince the rest of the village to listen to what the nurses are saying. And an interesting side effect or ripple effect that happened in Nepal is when the local villagers found out that there was an ultrasound machine available for prenatal scanning, it actually drew the women out of the remote villages to the clinic, and they were able to get their scans done, and it gave the nurses a chance to educate the mother about family planning, nutrition, general health, and it allowed them to touch these women that would otherwise not have access to medical care or medical education. So there was a secondary positive effect, kind of like flowers and bees. It attracted the mothers to the ultrasound probe, which is we're also finding in Haiti.
Wow, that's fascinating. Lena and John Cocky have a question.
Cliff, having been to Haiti and Nicaragua and some of the other countries, and actually Kenya that you're talking about, one of the key thoughts that I had is particularly these handheld devices. I mean, they really need to be as maintenance free as possible, because in these countries, if something goes wrong, it's really, really hard to kind of get anything repaired or whatever. And so I guess that is kind of my question is, what are the kind of maintenance requirements for these handheld devices, and if they get to these remote villages, how long can you expect that handheld ultrasound to continue to work?
Yeah, it's a great question. That was the challenge that we were facing is, can we bring technology into such harsh conditions? And when it breaks, it just becomes expensive door stops. As you know, in Haiti, the hallways in the hospital are filled with dead mechanical equipment. After the earthquake, you couldn't even walk down the hall of the hospital because they had all of these non-functioning X-ray machines and CT scans. Shortly thereafter. The beautiful thing about the new technology, like this butterfly and some of the wireless probes, is one, they're waterproof. Two, there's no buttons. They work on a cell phone, and so this is kind of a self-contained unit. I've been talking with the Butterfly team. One of the challenges is the battery life. This lasts about an hour, but you can charge it from like a portable battery pack or solar, and so if you use it continuously for an hour, it might drain, but then you can have an extra battery that charge it up, or you can charge it with solar and have it parked while it's sitting there. So all of these challenges of the technology in the low income, low resource, you can just imagine going up the Amazon River or sub-Saharan Africa, and the dust and the rain and everything else. These are fairly indestructible. What's unique about this probe, it's an American company that got the latest technology. This is made on a microchip. a lot of the ultrasound machines to date have small little crystals. In fact, this one has 128 small little pebbles, rocks, each connected to a wire that goes into the machine and records the ultrasound image. This is made from a chip that you could probably fabricate for $3 or $4. This, like I said, this costs about $2,500 right now, but I imagine that the price will go down. There are many Chinese and Asian, Korean, Japanese manufacturers that are making wireless probes about this size as well. They don't have the microchip technology, but they cost anywhere from $1,500 to $2,500 with Doppler, which means you can look at the blood flow, and this is a one-size-fits-all incredible technology. The bottom line is they have miniaturized the technology. Now it's just a matter of teaching them how to use it. You know, if we gave everybody their own helicopter and Amazon delivered it to your driveway and they said, good luck with that. That's the challenge, and that's the problem that we're trying to fix is how do you use this? Anybody can use this thing if they know how, and it's not dangerous. It's not like an x-ray machine that's going to cause cancer. You could put this on your head for an hour and you might feel a little funny, but it's not going to cause you much harm. In fact, most of the millennials today have seen this when they were the size of their thumbnail, you know, in utero, at least the ones in this country, and maybe that's why they are the way they are today. But the idea is that the Niyagi Project brings a lot of the youth interest together. In fact, I've got 4 summer interns that are working on the Niyagi Project right now with Haiti, rewriting the software, adding more information. We hope to have a high school Rotaract and Interact participation with this to try to find old iPads, repurpose these iPads that are sitting in people's drawers unused. They can literally be pulled out, loaded with the software, and save lives just with the education.
Great, Cliff. And Carl Kurtz has a follow-on question that I think is relevant here. Carl?
Yeah, thanks, Cliff. This is great stuff. I love your passion for it and the work you're doing. I'm interested to know how much funding you have, where does it come from? And I guess kind of a follow-on to that would be, what can Rotary and individual Rotarians do to support your work?
Yeah, well, you're looking at one of the main funders. It's been mostly self-funded, and we have a few very generous people who have found out about Niyagi and have been incredibly supportive financially for it. To date, we have been an entirely volunteer organization. All of the teachers that we've sent overseas have mostly done GoFundMe self-fund accounts. We have supplemented some with the money that has been donated by some others. In fact, one couple even put Niyagi into their will. They're still alive, but we are part of their inheritance. So we are literally a volunteer startup organization, very small, that I would love to launch into the world. As far as what Rotary can do, you know, the power of Rotary, as I see it, is one, the connections that Rotary has locally and around the world is just, you know, unmeasurable. And then the resources is really, that's a hard, you know, it's hard to say. I mean, each probe and clinic costs about $5,000 per clinic in essence to set up. That includes the cost of the probe, $2,500. You've got to buy an iPad mini for $500, so that's $3,000. And then the supplemental education of trying to get the transportation of the teachers into the into the teaching centers, etc., it might be an additional $1,000 or $2,000. So each clinic is about, we say about $4,000 to $5,000 of things. But if you look at the return on investment, if you save one mother's life at age 20 and she lives another 50 years, so that's 50 years of productivity, raising children and contributing to society in a low resource area. Let's say she makes $1 a day or $300 a year. $300 times 50 years is $15,000 return on a woman's life with a $2,500 investment. Now, if this saved 100 women's lives, that's a $1.5 million return on a $2,500 investment. You're not going to find that on Wall Street or anywhere else you go. And that's really just helping the economy of that country, let alone avoiding the orphans and everything else. So I guess, I meant for this presentation to raise awareness for people. Whatever ideas people have, we are very open. If you know people who are interested in women's health or children's health, etc., be more than happy to talk with them. And what we look for in partners are not people with their hand out, but people with a handshake. So we would like people that have skin in the game, so to speak. They have the in-country connections to allow us to teach ultrasound, but also have maybe the resources for sustainability inside of that country once we get it going, because we empower them with the skills to teach others, and so it's scalable. It's not just go into one place and do it. We want it to sustain and spread. And so the choice of partners is very unique, because they have to have the connections and the resources to bring it forward. Does that answer your question?
Cliff,
Thank you, yes.
thank you very much. I have the privilege of being your responder today, and I'm struggling not talking for another half hour on all the great work you're doing, but welcome back to Rotary. We're awfully glad to have you back. We're amazed and admiring of your work, and are just so grateful for your joining us today for this update. As you know, you have a number of fans within the Boulder Rotary Club who have been working on ideas as to how to provide support to Niyagi, and I'm sure that group of people interested in doing that is going to grow from here. You were very aware of Rotary's work internationally on the eradication of polio, and as you're probably also aware, in your honor and in gratitude for your talking today, we will be making a donation to the Polio Plus Foundation for 100 doses of polio. Thank you, Cliff, very much.
Thank you very much for letting me tell you the story. And I'll tell you how it all started, how a sports medicine doctor is saving mothers' lives in remote corners of the world over a glass of wine.
Thank you so much, Dr. Gronseth, and thank you, Paul, thank you, Gary, and Bill Anderson in the background, and Carl Kurtz in the background, taking care of all the questions. And Dr. Gronseth, I've heard you speak before, and I just love the work that you're doing, and it is something that we can, certainly see that would change the world. So good job. Thank you.